The role of language. Your choice of words in speaking and your attitude, conveyed through the tone of your voice, are very important. Language can act as a separator when you use special language or professional jargon when talking about people with disabilities such as client or consumer. Special language says people with disabilities are different. Instead, use everyday language, words, and phrases you would use when talking about coworkers, friends, and family members. For example, instead of saying John was placed in a job, say, he found a job, or instead of saying Jane transitioned from high school, say, she graduated. As a DSP, how you talk will influence the attitudes and interactions of others. Person-first language emphasizes the person and not the disability. The first choice is always to call someone by their name. If you have to refer to someone and mention disability, always put the person first. The phrase, a disabled person, can be disrespectful and emphasizes the disability rather than the person. You should say, a person with a disability. Instead of saying someone with Downs, say, a person has Down syndrome. Referring to the person first lets others know he or she is, first and foremost, a person who deserves respect. Respect. What's your role? Always ask the person's permission before you touch him or her. For example, if you are assisting a person to stand up from a seated position, ask, "May I help you?" Besides gaining permission to physically touch him or her, you may find that she is able to complete the action without any physical help from you. Avoid talking to others about things that could be embarrassing or personal for a person. If information must be shared, do it in a private, respectful manner. Don't talk about someone you support in their presence, talk to them and encourage community members to do the same. When accompanying someone to a medical appointment, encourage them to speak for him or herself. If the medical staff directs questions to you, defer to the person you support whenever possible. Use everyday language. Avoid jargon. The value of person-centered planning. The core of person-centered planning is to empower the person who uses paid supports to make decisions and choices that direct and shape his or her own life. The goal is to move from a needs-based system to a support-based approach. The support-based approach helps to develop personal goals and a life that is meaningful to the person using supports, while still addressing their health and safety. Person-centered planning always includes the person who is the focus of the plan and other people who are selected by them to participate. This leads to the achievement of goals that are meaningful to that person. Person-centered planning approaches vary, however, according to O'Brien and Lovett in Finding a Way Toward Everyday Lives, 1992, they are all characterized by the following 5 elements. 1. The person at the focus of planning and those who love him or her are the primary authorities on their life direction. The essential questions are, who is this person, and what community opportunities will enable this person to pursue his or her interests in a meaningful way? 2. Person-centered planning aims to change common patterns of community life. It stimulates community hospitality and enlists community members in assisting someone to define and work toward a desirable future. It helps create positive community roles for people with disabilities. 3. Person-centered planning requires learning through experiences of everyone working and thinking together and strives to eliminate separating people from the community or controlling someone else's life. 4. Honest person-centered planning comes from respectfully treating all people as contributing members of society. 5. Assisting people to define and pursue a desirable future requires DSP to focus on the goals of those they support, make a commitment to assist them, and have the determination and courage to help break down barriers. Consider for a moment. It is Saturday and you are planning on sleeping late after a really hard week at work. Just as you start a really good dream, you are transported to another life. In this life, a woman comes into your bedroom, throws open your curtains, and says, "Good morning. How are you today?" You glance at the clock, 7 a.m., and then try to roll over thinking it is just a nightmare, but the woman comes over to your bed and pulls the covers off. Are you ready to get up? Breakfast is hot and you need to eat. In this new life, someone else chooses where you live. In your new home, you are told what time you will get up, what time you will go to bed, what you will eat, what you will wear, what you will do with your day, whom you spend time with, and where you go. In this new life, no one asks what you prefer or cares what routines and rituals comfort you and add to your happiness. No one has asked who is important in your life, who you love and like to spend time around. Is this the kind of life you would want to lead? Do you see the importance of person-centered planning? Person-centered planning promotes the value that the wishes of a person are to be honored, based on what he or she considers important to them. These wishes might be stated verbally, communicated in non-traditional ways, such as through a person's behavior, or identified by other people who know them well. It is important that people know their wishes are not just written in a plan, but are heard and honored through positive acceptance, regular encouragement, and daily actions. DSP must be creative to ensure that people are heard by those who support them, and that their choices are respected and followed. Person-centered planning puts into practice ensuring that wishes, important to, are respectfully balanced with need for support to stay healthy, safe, and a valued member of the community, important for. From the standpoint of those you support. 1. Focus less on the records and what others have said about us. Get to know us as people. 2. Listen and hear our voice. We've got a lot to say. 3. Treat us like you want to be treated. 4. Ask us how we feel about things. 5. Make it your goal to help us accomplish ours. 6. Take time to explain things. Some of us take longer to understand what you are saying. 7. Put yourself in our shoes and walk our walk. 8. Always tell us the truth. 9. Believe in us and our dreams. 10. Be good to yourself too. We need you to be energized and to enjoy what you do. The value of dignity of risk. The concept of dignity of risk is the right of a person to make an informed choice to engage in experiences meaningful to him, her, and which are necessary for personal growth and development. Normal living often includes risks. Dignity of risk allows people to lead normal lives. Overprotecting people with disabilities keeps them from many life situations that they have the right to experience, and it may prevent meaningful connections and fulfillment of their hopes and dreams. Rather than protecting people with disabilities from disappointments and sorrows, which are natural parts of life, support them to make informed decisions. This enables them to experience the possibility of success and the natural risk of possible failure. Occasionally, as support staff, we believe we know the outcome for those who dream too big. Dignity of risk demands we try to help people investigate and reach for their dreams, while keeping health and safety at the forefront of our services. Dignity of risk. What's your role? Support individuals to choose attractive/fashionable, well-fitting clothing that is appropriate to the person's age and social setting. You are shopping with Joseph, who is drawn to a particular t-shirt with dicey graphics. You know that if he buys it, it will upset others. What do you do? First, explain what others may think or do if he wears it in public. Next, show him 2 or 3 shirts in the same color or style that are not offensive and explain why these are more appropriate. Ask him if he would rather pick one of these or another one on the rack and compliment wise choices. But the bottom line is, once he's informed, understands the consequences, if Joseph still wants to buy the shirt, he can buy the shirt. It is his right to buy and wear the shirt of his choice. You follow up by following your agency's documentation requirements in describing the support you provided and the choice Joseph made. Openly discuss options a person may have when they are faced with making a decision. Often making an informed choice takes many conversations to understand the risk involved. Take time for this. Be clear about your role. What is your core responsibility? How will you use creativity and judgment? What is not your paid responsibility? This means removing your own personal values and beliefs about the person's situations and choices. In her meeting, Sandra announced she'd love to be an airplane pilot. She has poor eyesight and cannot read. How do you help support her in finding a job? Maybe she'd like to work at an airport. She could learn more about what airplane pilots have to do in their job. You may need to role-play the conversations she might have at the airport when looking for a job. Talk about job possibilities before going to the airport. It might be a good idea to talk with the airport staff prior to going with Sandra to prepare them for the interviews. Your role is to create win-win situations. Click on the next link to continue the training part 3.